If you're getting value from working healthcare, I have a quick ask. Follow the podcast and leave a 5-star review on Apple Podcasts, Spotify, or wherever you listen to the podcast. That simple action helps more physicians and leaders find these conversations and better understand how our healthcare system actually works. And that matters because we can't fix what we don't understand.
You ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. I just interviewed Dr. Maryna Yudina, and the interview will inspire you on so many levels. She shares her personal journey from the Ukraine to the United States and reveals a central problem in our American healthcare system. Essentially, we are not focused on preventative care. We're focused on sick care. She talks about the difference between European medicine and the healthcare system and what she saw when she came over to America. She is a GI doctor, she is a neurologist, and she also studied rehabilitation medicine. She talks about what it takes to build those neuron synapses in your brain so we can actually all function while living our chaotic lives, because the truth is we all have ADHD. Maryna Yudina, welcome to Working Healthcare.
Hi, thank you. I'm so excited to be here. And I was driving from Aventura almost an hour and to get here. And I'm really very excited to sit in this chair.
Only an hour. That's good because you're actually in the studio.
Yeah.
And for those watching on YouTube, Janine actually painted the studio blue. So with your beautiful orange red hair with the blue in the background, it looks amazing. You are from the Ukraine, and growing up, your mom actually wanted you to be a musician. And you said, no. I mean, most of us in America are like, we're proud that our kid is going to be a doctor, but you chose the medical school route. What impacted that decision?
Probably, first of all, living in the house with a lot of art people coming and going is a little bit hectic. And also, my grandmother, my grandfathers, they was in the medical field. My grandmother, they delivered the babies. My grandfather, he was a neurologist. So it was a part of in my family that a medical part.
And you also tell me this little story about the dog that you had growing up and that impact on you wanting to go into the medical field.
Yeah, absolutely. When I was a child, I've been sick many times with a sore throat and some infections, and I stay at home a lot. And I have a little dog, a little French poodle. His name Bim. His name was Bim. So, and he was only my friend when I was staying at home. So I start playing doctor with him and treat him to make, I think, my health better. So this little dog became my patient, and he was very patient with me. So that little dog became my pathway, I think, to the medicine. And a lot of people ask me, Maryna, have you think about a musical career, everything? Never, ever. The music, the art, of course, it helps me to grow and who I am right now, my personality, my growth. But actually, the medicine was in my helping people. That was been since I was, I think, 5 years old.
Similar to my upbringing, my mom's a social worker, and there was no way in here in Hyola I was ever going to go into mental health. But it's helped me actually as a leader to navigate my way. And, I just judge people all day long. That's how it's helped me. You describe yourself as an overachiever, and you are very type A. Where do you think that drive came from?
Probably from my DNA, from my country as well, from my culture, from my parents who are also overachievers, and the whole family. But it's never been in my family that you must do that. You have to do that. My father always tell me, Maryna, do what your heart tells you to do. And when I even decided to drop the musical school for the last year because my beloved teacher, she passed away, and I told like, I'm not going to do it without her. And my father told me like, if you feel so, you can't continue, that's fine. Do what it feels for you. So, and that's what it's actually freedom of thinking, freedom to make choices for me, what's good for me. And when it's good for me, it's good for environment where people around me.
You went to medical school in Odessa
Yeah.
in the Ukraine. What was medical school like at the time when you went through it?
So when I went to the medical school, I was talking about overachievers. I finished my school, my high school, with the gold medal, and I had the chance to take only one test. And if I passed the test, it was chemistry, I will be admitted to the medical school. So I was 17 years old. And of course, I passed the test. And I became a medical student in Odessa University, Medical University, very well known in Eastern Europe university, one of the oldest, I think. It was a lot of work, of course, and it was 10 years of medical school. And I was young, and I get married young as well. And I had my son also very young, when I was 18 years old, and I went through the medical school with the child, with support of my husband and support with my family. But it was a difficult time because I loved medicine a lot. So I dedicated my life to the medicine and learning anatomy and learning biochemistry, learning all the medical stuff. But it's no life. It's no life behind the medical doors. In a way, like another students, they went to do parties and all of that. No, we spent nights in the anatomy labs with the corpse.
I can't even
So,
imagine
yeah, that
having,
was my life.
right, and having a child through medical school at that time in the Ukraine. How much time were you able to take off after giving birth?
Actually, the system was very good. I took 1 year with the full scholarship. Yeah.
Wow.
Yeah.
We need to get into something
Oh, absolutely.
like that. For sure.
I was surprised when I came to United States, and one of the girl in the office, she gave a birth to the child, and in 3 weeks she came back to work all stressed out. And I thought, wait a minute, why? What's happening? She said, oh, I can't afford it. So that was, for me, it was like eye-opening actually about the health system in the United States and social system.
Yeah, I remember I was 26 years old when I gave birth to my first child. I had just turned 26, and I did not go back to work, but I already knew before I left because I was going to take that break. But I remember sitting back going, 6 weeks. Most people go back at 6 weeks. There was no way I could have gone back at 6 weeks. I wasn't even sleeping.
Yeah.
My child was up all of the time, I think, until he was about 2.5 years old. But it was insane. It's so difficult to go through that as a mother. And I always look at doctors, especially in America, who have to go through that, and they return back after 6 weeks.
Yeah. So, yeah, no, I spent 1 year with my son, with my child, and I think that has also helped me to establish a relationship with my child. And I've done the 9 months of breastfeeding. And also I learned another new skills like typing and different skills. So, and but also it gives me the chance when I went back to medical school, I was fully engaged. And that was very important. And I absorb every information because, yes, my child was little, but in that time, I already have some support and help and care, somebody care about my son at home.
And you practiced medicine for a while in the Ukraine. Yeah. What did practicing medicine in the Ukraine teach you about people, about people's needs, about the realities of healthcare?
Reality on the healthcare in Ukraine that time, it was very sad reality because I finished medical school when it was the collapse of the USSR. system, and the USSR system, health system in USSR, it was very quite good because all the funding came from the government. We didn't have any system like insurance or anything like that. People pay out of the pockets. But when I finished medical school and I start working, we didn't have a salary for 3 years.
How did
And-
you support yourself?
Yeah, that's a good question. So you have to be very creative if you want to stay in your field. And I remember in the residency program, one of our professor told us, guys, if you want to be a doctor, you want to achieve something, you have to be the best of the best in your field. And at that time, I was working in it's called polyclinics at the general physician. And I have done a lot of home visits and also the patients coming to the office. And what I actually implement, like a private insurance, my own company, when I provide the people support for example, I'm going to check the patients every month, three times a month. So the families, they was happy to do that and pay me some fee, kind of under the table.
Going and doing those home visits, what did it teach you about people's lives that you wouldn't see if they came into a clinic to see you as a physician?
First of all, when you're going at the physician going to do the home visits with no car, you use a trolley or public transportation. You're on your feet all the time, and dark, cold, rain. Nobody cares. You are a doctor. You have to go. You carry big, like a suitcase with you, with all the stuff. And the most important, you bring your brain and your knowledge to the home visits, because you don't have anything with you and you need to take care of the patients and give them advices. And also that would help me to understand that not everybody in the same level, of course, on the social level. And people live a different life, and every life inside the home, inside the house, that affect people's lives and people's health. And compare, for example, my own life with their life. Like, I have to tell myself, Maryna, you are blessed. And don't complain about no hot water today in your house, because those and other people, they have no water at all, and they have water once in a while on a special hour. So it was a difficult time, but it's taught me to be humble, to be present, to listen other people needs, and be very resourceful how to help these people. Mostly our system, what I like about our system, mostly it was concentrating on preventive medicine. That's what the biggest part of our system.
And you weren't an internist. You actually have, you went through 2 fellowships, didn't you, or 2 residencies?
Yeah, neurology and then gastroenterology. And actually I added to my career, or my to-do list, rehabilitology. I start doing the dissertation, writing the dissertation, and my work at the PhD for the cognitive functions preventing the cognitive decline of the post-Chernobyl veterans. I work in a military hospital with that specific clients or patients. And that's what my dissertation started. Unfortunately, the funds was taken away, and I wasn't be able to finish that. But I get a good information from my patients, and actually it was close to my departure to United States. And before I left, my patient, they gathering together, and they all told me, like, please, Dr. Maryna, be a doctor. And we know that it's very hard to be a doctor in United States, but at least please help people. Use your expertise, use your knowledge to be who you are right now, because you help us tremendously. And that's actually stuck in my brain and became a hardwire and leading me, I think, who I am right now.
And you made that move in 2007. Why did you choose America?
I've been involved in the different programs in Ukraine. In Odessa, I was one of the leading in the program. It's a pilot project of the family medicine, implementation of the family medicine in Ukraine. Odessa was one of the pilot city, and I was the one who been leading that program. So I went to the different countries to learn the system. I went to Australia, I went to Canada, I went to Germany, I went to Amsterdam, and I went to Denver, to United States. And when I was learning all the systems and other systems, and when I came to United States, to be honest with you, when I went to the office with the doctors and sit, and I was thinking, oh my God, they have so many resources. They have so many money to buy a good equipments. If they would have a better brain, that would be better. Maybe, I don't know. That time it was, but then I learned about the system, American system, United States system. When I talked to the doctors in the office, and they told me, like I asked, the patient came and she, her complaint was about the sore throat and headache and something else. I don't remember. So he only checked the throat. He didn't check anything else. And when she left, I said, why you didn't check her heart? Why you didn't listen to her lungs? Why you didn't check like all her body? And he said, because of the insurance companies, when she will come back to me with a problem with the heart, I will check the heart. And for me, it was like, wow, what are you talking about? And of course, maybe I'm exaggerated a little bit, but at that time, that was, for me, it was like, my goodness, the approach we have and like creative mind we have at the doctors without all these equipments and all the opportunities, like, and that would kind of cross my mind, like, if I will have these resources, what I can do with all of that.
So that was
the aha moment.
That was more exciting for you than going to Australia or Canada. How did they differ than the resources in America?
They more about the funding, it's different, and the money, how they get the money, also the management of the system, it was different. Some of the system more bulky, even United States, it's very, very bulky system, big. And sometimes it's not communicating well with the different departments at all. And that's what I'll tell you another, my program that I implement in Alaska.
Yeah, because it's definitely fractured. Let's talk about Alaska. You went to Alaska and you went through the foreign medical training program. What did that teach you? What was that process like for somebody who practiced medicine in a foreign country, spent 10 years post-high school training to be a physician, practiced as a physician, and then coming over to America? What was that process like?
The process was very, very difficult and quite interesting for me because I'm the person who think about the strategically thinking. I choose that my pathway. I choose that life, and I came to United States, and I came to United States and to Alaska. It was the good resources in the hospital settings in that time, so I was able to work and learn about the medical system in United States from the bottom to the top. And that was been very interesting for me. While I am been preparing for it's called USMLE test exams, that it's very demanding and it's all computer based. And what was very challenging for me, that I don't have time to think and make clinical decisions. You have to answer those questions only based on the yes, no, kind of 60 seconds. And I failed a couple times. I failed 3 times with my first step. And then I restructure my thinking and I went to the Kaplan University in California and I get that education, and that was a better structure. But as more I learn about the system, as less I want to work as the physician in the system.
Well, let's talk about the system, because I'd like to learn about what you thought as a physician coming from Odessa. You had trained at various areas around the world, and now you're in Alaska. What did you see about the values of our American healthcare system and what we prioritized at the time?
The values, definitely the opportunity, the funds, the money that is going to the system. And with the right approach, of course, it's very helpful. But also what I implement in Alaska, I start working in the different positions, and then I became a leader of the program. It's called, I was the quality improvement director. So, and it was the program we start implementing the how to deal with the medical errors. And learning that how many medical errors occurs in the medical field, that was like, it was shocking, actually. And that's, I learned about the communication between the departments. Where are the gaps? Where are the communication issues? Where is the problem? Which department? And that was a big program that we start implementing in Alaska. And I was the one of also those programs. But learning more about the system, I more been thinking about how I can utilize my expertise, all my knowledge and education, and not be a prescriber of medication, let's put this way, or not be following the only pharmaceutical leads.
Well, let's talk about the pharmaceutical leads. In 2024, the average cost per person of spend in America was nearly $15,000. So I really want to know, because we spend far more than our peer nations on medical spending, but from your perspective, why does all that spending still not produce preventative care? It seems though we're focused more on sick care and rehabbing somebody once they're already sick, but we're still not spending on the preventative care. What's your perspective?
No, to be honest,
I don't want you to lie to me.
And what I could see, preventive medicine, it's not giving you a lot of finances. And that's what I saw. And that's what, when I became a part of the medical system in the United States, it was really get to me when some of my friends told me, like, oh my God, my child's 7 years old and they want him to be on Adderall or Ritalin because he is not performing well. He's a little bit not focusing well, or he's all over the place. And it was like, wait a minute, what? Did you try something else? He said, no, the doctors want me to put him on medication. So, and it's only one case. And of course, it's a lot of cases, and working in the system to see, of course, like, okay, where are the money flows? Of course, the money, we're talking about the big pharma, and the money goes to the pharma. And I'm not against the medication, not in any circumstances, no. But we can do much better and spend more funds to prevent the disease and use that funds that left over to something better: education, preventive medicine, health, improve cognitive functions, helping kids. All, it can be done differently. But what I saw, that's why I don't want to be a part of that system. And that's what my approach been looking for, the opportunity to how to utilize my skills and my knowledge and transition from the traditional medical field. And then I transition to the leadership position. And then I transition to the brain optimization programs.
Europe definitely seems more focused on prevention and preventative medicine. Do you think that's mainly cultural, economical, or the way that our system originally was set up?
I think it's all three of that. It's not only one thing, but how the system was set up, of course, it's a fact how people follow the system. Because again, in Ukraine, in my country that time, people doesn't have the finances to buy all these fancy medications. So we have to come up with the preventive measures. And it was a part of my medical education in medical school. It wasn't like only one semester. No, it starts from the beginning and it went through all 10 years of medical school. Prevent, how we can prevent, how we can help. We have a lot of facilities that people go with like a beginning of the different disease, heart disease. We have it's called sanatorium of the facility that we can use all the resources, acupuncture, physical therapy, meditation, no medical approaches, not medication approach to help people to not get to that part when really medication needs. So it's always, we want I want to catch the window before the medication needs. And that's what preventive medicine.
And that makes sense. And do you think if our healthcare system was government funded, we would be more interested in preventative care as opposed to just what shareholders want in creating new medications to cure or to stabilize diseases so that shareholders can get more profit?
Yeah, it's a big question, probably for a lot of different podcasts.
Well, what I'm thinking is that there was something new that was implemented. It's called Principal Care Management, and it was by CMS. And Medicare beneficiaries can actually receive up to 90 minutes of preventative care coordination to help them avoid getting into the hospital or, much worse, death. And it's encouraged and covered by the Medicare system. But Medicare Disadvantage plans and commercial insurance companies don't cover principal care management.
Yeah.
And I'm just thinking about that as you're speaking and going, oh my God, maybe, and I never thought I would be interested in government funded healthcare, but I'm just thinking the only way to cut the cost is to maybe include more government intervention.
Exactly.
Because then the goal changes.
Absolutely. Yeah, I'm absolutely agree with you. Because that's what happened when what I saw in the system, and I've been in the United States now more than almost 20 years, I think more than 20 years. The people going to seeking the medical care when they are really it's like we need to do a surgery or we need to, or emergency. And when I talk to people why going to see the doctor before it's happened, before we still have this window of opportunity, before we have to go deep down to the medications or surgery or more invasive approaches. And what people tells me, of course, and I'm the one also in the system now. So, oh no, I better wait, and I can't because I can't afford it. My insurance doesn't pay for that. And then I will have a big bill. So it's a whole system needs to change. And I think now what I see, it's a more attention to the make America healthier again. And that I like that movements. And I would like to talk more about the prevention and preventive medicine and measures in the system, in the leaders, with the leaders and healthcare professionals.
Because I actually did a little bit of research and saw that the CDC claims that 90% of healthcare spending goes to chronic and mental health conditions. 90%. So I'm looking back on this and reflecting about what does that tell you about where the system is failing upstream? What can we do to decrease the costs? what can the government do to decrease costs? Because you pivoted away from sick care by pivoting how you practice medicine in America now that you came over from the Ukraine. But what is that saying about the failure of preventative care and looking at it and projecting as to how it impacts us in the last year of our life and in these chronic conditions and in these mental health conditions?
I think that needs to be changed and done on the level of the start with the medical schools and medical professionals. Start to have courses about the preventive medicine and how we can prevent, what we can do about that before the depletion starts. And that should be big focus on that. And my belief, it's not even close to that. I don't even know if they have. Probably, I don't want to be a bias, but I don't think that's a lot of attention in the medical schools for the preventive medicine.
Besides medical school, where do you think the biggest opportunities are for preventative care?
I think the programs we can implement and the programs that health professionals or social workers also can be involved in that and educate people. We need to educate community. We need to educate people. When people, for example, coming to me and talking to me about the fogginess, sleep problems, decline of mental functions. So I saw that if I would start with that person 2 years ago, it would be much easier now to help without going much deeper and spending more resources, more money, actually, to helping that person. I work with the highly professional and successful people, leaders and overachievers who very well understand that that depletion can cost their careers. And that's what my point was, to help kids, adults, to prevent that burnouts before it's happened. For example, education on the system, like pay attention when your sleep became not so deep, when you start waking up 3 times at night instead of 1 time at night, and you're thinking constantly, and that it's hard for you to fall asleep. When you feel like going with your family and having fun, you don't have any fun because you feel guilty not checking your work stuff, because you feel if you will not be on top of things, you will lose money, you will lose control. So that's what but people need to be educated, not many people who understand that.
Even if they're educated, though, don't you think it's cultural? People do not like delayed gratification. So if smoking a cigarette now or pot or eating that Oreo cookie now gives them immediate gratification, they think in the long term, down the road, I'll deal with it.
I'll deal with that, exactly, yeah. The system set up with like some people who came to me like, oh, I have this and that, and like, can you fix me? So the word fixing, and they said, I'm not a fixing, that's a CVS pharmacy or any pharmacy, okay? So that's a fixing. So that's what they became, of course, it became a culture. Look at the movies. I was a child when I watched the American movies, all these little bottles, orange bottles in the bathrooms, and the fancy sound of this pills, when they took those pills, you look at that like, oh my God, it's so fancy. It's fantasized. And that's what been in the movies and the culture. That's what I slowly but steady, it became from the software, became a hardware that you have to take a pill for everything.
And right now you're focused on preventative brain health. You're focused on stress resilience and performance. What do you see as the biggest challenge when working with your patients?
The biggest challenge before and after?
I guess, I'm thinking I would go to you and say, hey, Maryna, I'm not eating as well as I could. I'm having issues with my sleep. I'm having issues with a myriad of items. And I know what I should be doing.
Yeah.
But it's actually doing it and getting it done.
Yeah. Yeah. So then the people, actually, it's a very, like a simple my program, what I set up. I mean, it's sounds simple, but it's, of course, it's a lot of deep work with the patients, with the clients. It's assessment. You need to assess the situation. You need to let the person know that, okay, this is not your problem, and we can work on it. We can change the past, but we can work with the present, and definitely we can change the future. And also another part, assessment, then training the brain, and then maintenance of the continue to change your life.
How do you train the brain?
How I train the brain. With the, my work, it's a bridge with the neuroscience. So I use all my expertise as a medical doctor, plus neuroscience, bridge with the medical and neuroscientific part, and plus the program that helps not only the brain, but also in combination nutritions and exercises and physical activity. It's a complex. And then when the people coming to me, they're not coming to me as the brain trainer or like life coach, for example. It's all together. And that's how it's supposed to be. So in preventive medicine as well. And how I train the brain, it's called the program, it's called neuromodulation or neurofeedback, that it's non-invasive, medication-free, that helps the system, that helps the brain to self-regulate.
But people want a quick pill. People want to just have their issues disappear in an instant. We're America. We love instant gratification. So what type of people do you look for, and who can you help? Do they need to be the type A focused person that you are, or are you able to work with people who want the quick fix?
Usually people who are coming to me with the quick fix, it's not my people, but they became my clients eventually. Before our conversation, I had a conversation with your staff, and we talked actually about that. And the person who came to me 3 years ago, and the gentleman, his wife, saw the problems coming, and he came to me and he said, I'm fine. You know, the man usually said, I'm fine, I'm good. Nothing needs to be fixed, nothing has to be done. And in even that time, I've done the consultation with him. I explain what can be done before it's too late. And then I left it like that. And I know it will be time. Then, and 3 years ago, 3 years later, right now, like he came back to me and he said, you are absolutely right. Now I can sleep. I constantly thinking. I have a catastrophic thinking about the future of my kids, and that it's also, I can't relax. I can't switch my brain. I can't relax. I sleep is terrible, and focus is terrible. Brain fogginess, that's what the main issue on the leaders, that I can't concentrate very well. And I told him, if we would start 3 years ago, it will be much easier way. Of course, we start working, and then in the 5 sessions, he starts sleeping better. He saw the like a light in the end of the tunnel from the how his brain or how his nervous system can regulate, self-regulate, and how he can start thinking about what my personal needs, when I need to eat, when I need to sleep, because we are like with all the happening right now, it's the world is very busy and very fast. Everything happened overnight, or
and
even
it's depressing.
less.
And
it's
listening
depressing
to the news,
yeah,
it's such a downer.
Yeah, and then it's, of course, it's create the situation with the leaders, with the families, with the people, like, oh my God, what can I do about all of that?
Does insurance cover this?
No.
So how do you explain that to patients about the need? And then I also want to know, why do you think insurance won't cover this? Don't they actually want to save themselves money from spending on sick care?
I think not. I don't think they want to save money to spend. They want to spend more money on the...
Well, my thought process is that patients are on United Healthcare and they get denied claims or they don't receive the prior authorization to get this type of care. And then they're hoping that when there's renewal, that the participant will either change jobs and be forced off of United Healthcare, or that the person will not be able to afford the renewal, or the person, I don't know, maybe dies and no longer is a burden to the system.
Yeah, it's a big problem and big question that it's actually definitely needs to be addressed. And I am glad we're having this conversation. And even if we have a response for like, some people doesn't like it, of course, and some people do like it and agree with us. But we need to have a voice and we need to talk about that and bring attention to the problem, because it's a big elephant sitting in the room that everybody try to avoid this elephant. No, it's sitting in the room and we have a problems. And look, when during the COVID even, how people react on the situation. So the situation became because they didn't know what to do and how, because of lack of education, actually, lack of information about the viruses and how you can prevent. So, for example, people coming and they using the same mask over and over.
No, they don't even know how to put the mask on properly.
Exactly. Yeah. So when I saw all of that, I educate my people, who have been coming to me. But that's what the preventive medicine, that's what prevention, it's called prophylactic. That's what it needs to be done before the problem became a huge problem. So, and that's a prophylactic measures, prophylactic treatment. That was a big part. It was a big part in my medical system in Ukraine or in Soviet Union, let's put it this way. And it's still a big part right now as well, preventive medicine, prevention before the bigger problem starts.
And again, it's because there are limited resources. So if you can prevent, you're not going to spend an avalanche of money
on the
chronic conditions, on the person's last year of life, on these mental health issues. You talked about brain fog. I feel like I have had brain fog more and more incessant as I've gotten older. And my friends want to throw it out and say, oh, Meredith, it's menopause. I'm like, I can't be menopause. Like, why am I experiencing this? You are very involved in women's causes and in leadership organizations. Anything to do with the whole menopause pathway that I'm experiencing?
Pathway, exactly. That's the right word, pathway. So I need to see your pathway. So we have what my specifically work, what I do. So I check, like I said, it's called a brain assessment. So we have 19 big regions in the head. All these big regions divided on the 55 areas. And I do, it's called quantitative electroencephalography. So I'm recording the electrical activity from all these different areas. And then I create it's called brain map or assessment, and see which areas of the brain are lacking of electrical activity. Because the brain is like a computer. So we need to check that. So you are using, because you are a highly successful woman and you are moving forward to your career. So all your focus on your family, kids, and your business. That's what women who coming to me, business. And we as the women, we have a lot of in our plate. Because we are mothers, we are grandmothers, we are caregivers, we are wives, we are girlfriends, and also we are business ladies. That it's very difficult still in this world to be a businesswoman and also be a mom at home.
It's so difficult. I'm sitting back thinking, is this because we're so diversified in so many areas? I performed in theater in high school and college. I used to memorize entire scripts. I can't even memorize a question now. Even I have notes actually for these interviews because my memory is not nearly what it used to be in my teens and my early 20s. Do you think it's because so much has been added to my plate?
Absolutely, yes. And that's exactly what the when the ladies coming to see me, and not only women and the guys, so all. So that's exactly what they, the first thing they said, like, I'm not the same as I was like 10 years ago. Of course, we are not the same, yes. But can we prevent that depletion? Yes. Can we prevent and be, the brain can be more resilient? Yes. Can we use the switch in the brain when we need to switch between the different tasks? Yeah, we just need to know how to do that. Because when all the resources from your nervous system, from your body, from your vision going toward the one goal, so that's became anxiety, became a little bit depression, mood swings, and everybody said, oh, you menopause, like forget about that. You get over that, chin up and move on. So no, don't chin up and don't move on. Of course, do, but with the right resources, it helps. I can help with the situation that not became dramatic decline of the cognitive functions. So we can work with that. So all the technology, we just need to use it properly with the proper knowledge and expertise. The expert needs to do that.
Besides going through the whole gamut of tests, which now I'm sold, I need to figure out a solution to go down to Aventura, which is only an hour, it's not that far, and be able to go through this assessment, because I'm really getting challenged throughout this process. And that's what I say. I think it's because I have so much stimuli coming at me that it's so difficult to hyper focus. I joke that I have ADHD, but I think we all have ADHD.
I know that we all have ADHD. And, I've done a lot of brain maps, and I speak with a lot of people, and including myself. We can't be not ADHD. We have to be in this world, but can we manage that? That's another question.
That's what I need to figure out. And so I ask you, what can people do now? What can I do now? What can listeners do now as a prelude to, okay, taking all of the testing, figuring out how to manage it? What is one pearl of wisdom that you can offer me now? Say, Meredith, this is what you can do now to help get through your ADHD world.
Wow, if it would be so easy.
I know.
It's like give me a pill and fix me. Yeah. So what I usually recommend, listen to yourself. Find the time, listen to yourself. Do the breathing exercises. People sometimes, when I do the workshop, they told me recently, I've done a workshop with the lawyers, and they told me, I don't have a time to breathe. And then he even stopped talking, like, exactly. That's what you said. You don't have time to breathe. So you need to put it on your schedule, like 3 minutes, or put it on your cell phone or on your wristwatch, notification, like little beep that it's my time. At least 3-5 minutes just to do box breathing exercise. It's like breathe in, hold, breathe out, hold, and that's do the circle. That's already reset the brain and start thinking more clearly. So,
and there aren't enough hours in the day, though,
no.
Maryna. Like, how do you say no to other people?
It just needs to become a habit. And that's what the habit, that's the most difficult part that implement in our life. So we have a habits of drinking coffee. We have a habits taking medication. All these habits, but to break those habits and to implement the new habits, it's requiring new pathways in the brain. So I can help with that for sure. But also you can train your brain at least every day for 3 minutes in the morning, 3 minutes in the afternoon, and 3 minutes before you go to bed. Another, what I always recommend my ladies who are mothers, who are leaders, who are wives, before you get home from your meetings, you get home, you stay in front of your door, take your time. Take your time and switch and breathe in, breathe out. And imagine, close your eyes and imagine that now you open the door, it will be dog running around. It will be mess in the kitchen. It will be kids asking, mommy, what for dinner? Mommy, what in that? Oh, he hit me. Oh, she hit me. So you are not a businesswoman in that environment, and that you need to switch to that role. It takes time. It takes time to learn how to do that. But it's crucial. It's very important because we have so many hats, wearing so many hats, and we need time to switch the switch. When I was young and I was working in the medical field, and when I had my night shifts and I was coming home after the difficult night shifts, you saw the death, you saw the blood and all of that. That's medical field. So I know I have to stop in front of the door. I have to close my eyes. And I told myself, Maryna, the doctor stays in the doctor's office. I'm a mom now and I'm a wife now. And I imagine what my son and what my husband doing right now behind those doors. And I breathe in and breathe out and smile and open the door and mommy home. So that's a very important part now in our days that we are very busy. Switch, you learn how to use your switch in your brain.
I would say compartmentalize. And we as women, at least I do, I have to make sure that I'm not feeling guilt over it. Why do I have to respond to emails at 9 p.m. at night? Why do I have to respond to emergency phone calls at 10 p.m. at night? I need to be able to make that switch because I also believe that it would make me a happier individual. Mm-hmm. So again, my year of no, this is my year of no. I need to figure out how to prioritize and how to compartmentalize. I want to wrap up the interview. Somebody who went through all of her medical school training and practiced medicine in the Ukraine, someone who is moving or has moved over to the US and has lived here for 20 plus years and is practicing a different type of neurology than what you had practiced previously. If you could create one change within our American healthcare system, what would it be?
Preventive healthcare. Yeah.
On that, I'm ending it. So thank you, Maryna, Yudina, for joining me on Working Healthcare.
Thank you so much for having me here.
If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.